to the room.
Okay, hi, I'm Dr. Chase, and I'm one of the junior doctors working in the Pediatrics department. Can I get your name, please?
Hi, doctor. I'm Melanie Khan.
And what's your age?
I'm 30.
Okay, and Melanie, I see that you're here with your child. Can I get his name, please?
Yeah, it's Jenny.
And how old is she?
She's 2 years old.
Okay, Melanie. So tell me, how can I help you today?
Doctor, I'm really worried, doctor. She just had a fit at home just a couple of hours ago. I'm really scared.
Mm-hmm. And has she had any fever, any vomiting?
She had fever, felt feverish, but yeah, no vomiting.
Okay, okay. And has she been having a headache before?
I mean, she doesn't say anything, but she keeps pulling on the ear. I'm not really sure what that is, though.
Mm-hmm. And was she ill recently? Any cough?
No, cough.
Nothing like that? Okay. And when you talk to her, does she respond to you?
She just says, a few words. Yeah, like when the fit was happening, she was completely, non-responsive, saying anything.
Okay. And can you tell me how much was her fever? Have you taken her fever? The
No,
temperature?
I didn't check the temperature, doctor.
Okay, okay. And can you tell me more about how it went? Like the fit? Like did she had loss of urination or anything?
No, not really, but she just, fell down on the ground and just started
Mm-hmm.
shaking.
Okay, okay. So when she fell on the ground, was she hurt somewhere?
I don't think so. It was just sitting down and then fell.
Was she pale to you?
After the fit, yeah, she was very pale,
Okay. What
floppy,
about, sorry, you were saying something.
and
Probably.
she was floppy. Wasn't
Oh,
moving. And
I'm so sorry to hear that. That must have been distressing for you. So just to make sure, did she pass her urine while she had that episode?
no, not really.
Okay. And was her skin dry?
No, seems fine.
Okay. And what about after it? So after it, was she fine? Like,
Uh,
how was she behaving after the fit?
no, she was completely normal after that.
Okay. Okay, thank you so much. So do you have was this the first time this has happened?
Yeah, this is the first time, doctor. I'm really worried. It's very scary for me.
Do you have any idea what it could have been?
I have no clue. I heard something called meningitis, which is,
Mm-hmm.
I know it's very scary. I hope it's not that.
I understand it can be quite distressing and overwhelming when your child is having this episode, but let me go through a few more questions and then we can understand the situation much better. Would that be okay?
Yeah, sure,
Do you
doctor.
have any other concerns other than this?
No, like what, doctor?
Okay. And just to make sure, how was her pregnancy? Was she fine? Was her pregnancy complicated?
No, it was normal delivery and
What
everything was.
about, sorry, yes. Okay. What about her vaccinations? Were they all given on time?
Yeah, she's up to date on everything.
Any allergies?
She has allergy to amoxicillin. That's what they told us last time when we came.
Mm-hmm.
Yeah.
Okay. And anything like you think that could be causing this? You have no idea, right?
No, I hope it's not meningitis, doctor.
I understand. Do you have what do you expect towards the end of this consultation?
Yeah, I just want her to be fine. I really don't know what is happening.
So what I'm going to do now is I'm going to take the baby's vitals and I'm going to assess the temperature, the blood pressure, the pulse, and then I'm going to do a head-to-toe examination. Would that be okay?
Yeah, sure, doctor.
Okay. Okay. Okay, so from what I have understood, from the given examinations and everything, I believe that the child could be having something called a febrile seizure. You mentioned that she had a fit and she had fever at that time when she was having a fit, so she could be having a febrile seizure. And I'm sorry, I forgot to ask this before, but did you know the time she had this fit for?
It was like less than a minute, maybe like 30 seconds.
Okay, so since it was less than 30 seconds, I believe, right, she's completely fine. I would like to assure you it is not meningitis and she's fine. She's doing well right now. I see that there is redness over her left eardrum, but that could be just due to the fall that you have mentioned. I would also take her to refer her to the ENT just to explore, but since there is no discharge or her rest of the nose and throat are normal, I think you can be assured. Now let's talk a bit more about febrile seizure. Do you know what are febrile seizures?
Doctor, she was having
Minutes remaining.
Some discharge, and she was actually pulling on her ear a lot.
Oh, okay. So yes, it could be due to, okay, so then it could be due to an infection from the ear. It could be acute otitis media, and I would have to, but since you mentioned she did not have any other episodes of cough or anything, what she had that fit particularly was just a febrile seizure. So febrile seizures are something that when the child has a fever above 38, they sometimes have a fit, but it's completely normal to have it. And since she had she had like a minute, she said less than a minute, 30 seconds, it's completely fine. I would give her some paracetamol so that her fever can be reduced down. And then we will refer her to the ENT to see more about her ear problem.
Okay,
Would
yeah,
be okay?
sounds good. But what is this febrile seizure, doctor? Why did this happen?
So this is just due to the temperature of the body was above the normal for a longer amount of time. So that is why the body went into a stage of fit. That is what has happened. Is
Okay,
that
we gave
clear?
paracetamol at home, but is there anything else that needs to be given?
No, not really. The paracetamol should work, but since the seizure was less than a minute, like you said, then it's completely fine. You would give her another paracetamol. As you can see, her fever is still 38.5 degrees. We would still give her another paracetamol to reduce the fever. Okay? Any more questions?
Like, will this happen again? I'm really scared. Like, what am I
Yes,
supposed to do again if it
yes, it
happens?
can happen again, but it is completely fine, and I would assure you to just give paracetamol at that time as well. Okay?
Okay.
If it happens again, I would also tell you to come back to the ED as soon as you can, okay?
On to the next station.
Okay. Oh my God. Okay.
Like
I didn't
really,
even, so sorry. Oh my God. I was supposed to finish it in 8 minutes. That was not 8 minutes. I think I went longer on my history taking.
yeah, that's a very common mistake that most people do, but not bad. Your the
It was very
way
bad. Okay, you can say I was
way
bad.
the way you were speaking, the way you were consoling the patient with the relative is very very good. So that's basically in personal skills. That's really important. Yeah, and so basically, since you took a lot of time in your data gathering, your management took a hit. So it's supposed to be 4 minutes for your data gathering and 4 minutes for your management. So because
Okay.
they both carry equal marks, right?
Mm-hmm. Mm-hmm.
Uh, Otherwise, it's good. You covered everything. And yeah, I think one thing that you missed was the fact that was there any discharge. So once you ask an open question, you need to follow up with closed questions.
Okay.
I mentioned she was pulling on the ear, right? So you just ask was there any other symptoms, but you need to you ask cough and anything else like that. So
Mm-hmm.
when you say that, they usually don't like to give up in all the information. They always
Okay.
ask you whenever you ask, is there any other symptom? They'll always ask you like what. Right? So they
Mm-hmm.
always expect you to ask in closed questions. They always follow up your open question with closed
Mm-hmm.
questions, but they have to be very specific. That way you won't waste time.
The thing is, I got confused since he started with the fit. So my thought process went, okay, maybe she was having a febrile seizure since she was having fever at that time. So I was concentrated on getting that. And then I was like, oh my God, is she having acute otitis media? Because she has redness. However, she doesn't have this. So I got confused in the middle of the session, and I was like all over the place. I was like, okay. But then at the end, I went with febrile seizure because my hunch was since she's having a fit and she has fever, so it must be that. I am not sure about my answer still. I don't know what's happening, but I suppose
perfect. There's no set way to do the give the diagnosis out, because fever obviously has some cause, right? It's definitely here the cause for the fever is the otitis media, so it's fine.
Ah, okay. So we don't actually have to mention otitis media, or did I have to mention it?
You do.
It was febrile seizure. Oh my God, I'm so happy. Oh, thank God. My hunch was right. It was febrile seizure. Okay. Oof.
Well, I just have to start off by saying that was a very good consultation for the first time. I mean, you almost got, I mean, you're right on point when it comes to talking to the patient. You know, you're actually acknowledging the feelings. You're actually asking them what their concern is, what their expectation is. That's like a very good approach. So I would say that 60% of your work is actually done. Now you need to formulate a structure. So that's where you need to understand the case a little bit. So when you hear that a child has come with a fit, right? Your mind went to febrile seizure right away, isn't it?
Yeah.
Because it's a common presentation. But before that, what was the mother's concern? It was meningitis. Did you rule out meningitis? Did you ask any questions?
I asked headache, and I asked like, was she having any headache, or just headache. And then he said that, of course, a child can't tell. Yeah.
So what is the other thing that would come to mind? Usually men
shying away from light, I suppose. That would comes to my mind right now, if she's shying away from light. Or neck stiffness, I suppose. I should have asked.
Exactly, because those are more indicative of meningitis in this case, right? Does she actually cry if you're lifting her head or something like that, right? So when you're actually thinking of a symptom, so the symptom that you have at hand is a fit. So when you're actually coming to your diagnosis, even though you have a probable cause, but you have to rule out a lot of things. So how do you go about ruling things out? You should start by ruling out the most critical thing that can cause this problem, right? So you start with critical, you start with cancer, then you go with common. So it's the 3 C's of ruling things out. So when you're asking questions, you should ask them in that sort of an order, because what the examiner is trying to see is that you're a safe doctor, right? Because accidentally, if this happened to be meningitis and you did not catch that, I mean, it would be a lawsuit on the GMC. So if they are recruiting you as a doctor, they need to make sure that you don't rule out the most critical things. So, take on that persona, think about those things first. So any symptom that comes to your mind, I mean, any symptom that is presented to you, first rule out the most critical thing that can be associated with it.
Yeah, like think about what's the worst thing that can happen to this patient. Whenever you see any patient in any of the stations, always think about what's the worst thing that can happen.
And most of the adult cases, you will see that you will have to rule out the cancers first. So there are very specific questions associated to, such disease processes. So you'll understand what is actually happening. So now you know that this is, so once you do rule out, meningitis, the other thing that you could think about is she epileptic? Right? And the other thing, so you need to ask medical history. Has she been diagnosed with any medical history? So, but then you will come to that eventually, because you have to start with the presenting complaint. So whenever a patient comes with a presenting complaint, one thing you should definitely ask is, can you tell me about what happened? Right? That's the perfect open question, because that way the simulator will actually give you some clues. So you can actually go on that. So in that, you can rule out a lot of things. So can you please elaborate what you exactly mean, or can you just explain me what actually happened, so I would be in a better position to help you, right? So that like a way for them to vent. So they'll say a lot of things, so you'll get a lot of clues.
Yeah,
Right.
I don't think you did an open question. So
No,
always,
I started with how can I help you? Yeah.
no, not
And then
that. The presenting complaint. After the presenting complaint, you always have to ask, tell me more. So
okay.
please elaborate what you mean.
So once you get a presenting complaint in hand, you need to understand the most related clue. So that's the best open question to go with. Like, can you tell me more? Can you explain what you mean by that? Right. So sometimes I'm feeling short of breath. My heart feels like it's racing. Like, could you please elaborate? Can you tell me what you mean by that and how this came on? Those questions will give you like, and that will be like opening the floodgates for them to just vent themselves out, and that will be to your advantage, because in this exam, whatever the simulator says, it's a clue. So definitely pick up on that. If they're talking, that means they're actually giving you a hint, right?
Okay. Got it.
So, all right. So after your open question, what is the first thing? So you were thinking febrile seizure. So you understood the fact that she was having fever. Right? Now you need to understand the source of the fever. So most likely the fever is due to infection. So you have to go on asking about the systemic areas where the infection could be. So you did ask about cough, but then you didn't ask about anything else, like what else could be the problem? How is her wee and poo? Right? You need to always understand, like, is it a urinary tract infection? Is she having any bowel infection? Where is this infection? You understand she's not having any cough or any expectorant. So it's not a chest infection. So where is this infection? What could be the source of this infection? So the mother said that she keeps tugging on her or she keeps pulling on her ear. That's a clue. Like, that's when the simulator talks, that's a clue. And then once a clue is given, just ask them, like, could you explain a little bit more? Like, is there anything else related to that you want to tell me? So she would have mentioned discharge. There's also, I've seen that there's some fluid coming out of there. Right. So then you get an idea that that's an infection. That's your source. So you got that source, right? So once you get a source, that's what you have to ask questions related to other sources of infection. So then you know that this is an infection. So this will eventually come back in your management, because you have to treat the source in order to reduce the fever. The fever is in response to the infection, right? So if you don't treat the infection, the fever will still persist. You can't just keep giving paracetamol, right?
Yeah, that makes sense. Yeah.
So you need to understand what is causing this fever, right? So once you, so then you have the presenting complaint, elaborate the presenting complaint, and you did that beautifully. In fact, FIT has a very special way of elaboration. You always have to ask, what was she like before, during, and after? And I think you covered that very well. I mean, you tried to ask about the incontinence, but sometimes if there is no incontinence, not like all the symptoms have to be there. So he mentioned that she went floppy and pale, but then you need to ask what happened after. After you have a seizure attack, one important question is how long was the seizure? Because you need to rule out the emergency here, right? Because if it's more than 5 minutes, that's an emergency, right?
Yeah, I came towards the management and I was like, oh my God, I forgot to ask how long was it? And then I asked, and then he said less than a minute. I was like, okay, we're in the safe area.
You're lucky, because that's what they are trying to understand if you're a safe doctor. So the most important questions related to the symptom needs to be ruled out, because if this does not come in your presenting complaint, if this does not come out as in your initial round of questioning, it should at least come out in the safety netting. Meaning, when you're giving them a management plan, you also have to send them with a management plan to tell them, but informing them, what they should look out for, what accounts for an emergency. So if you see that this happened, and if it is ever more than 5 minutes, please go to the emergency immediately. See, these are the things you have to mention to them, because these are the things you can't miss out. If a patient has come to you for consultation and they go back without knowing what are the most dangerous things that can happen with this presenting complaint, that's kind of on you, right? You were able to fulfill that task of informing them. So these are the things. What I'm trying to say is, these are the things that they're looking out for. And that's why we have the checklist. So we'll just go through the case together. So, right, presenting complaint. Could you tell me more about the fit that your child had? That's a very good question to ask. Or to the before, during, and after history, which was really well asked. Sometimes they may actually offer up this part of the information where they go like, you know, I've noticed that she keeps pulling on her ear, or sometimes you might have to get it out of them because you're trying to look for the source of the infection, right? You asked about the fever, how high, which was not measured, which is most of the cases, ruling out systemic infection. So if you're thinking about chest, cough, or any, you know, sputum from her nose, GI, how is her bowel, and bladder habits, right? Meningitis, rash, neck stiffness, shyness to light, right? And urinary again. So does she cry when she, you know, pees? You know, those are the things that you can understand that, all right, this would be the source of the infection. And yeah, now you need to understand a little bit about the medical history. So after you got your presenting complaint and you've elaborated your presenting complaint, and the usual ways you go about elaborating presenting complaint, because this was a fit case, so you'll ask these kind of questions. Otherwise, you ask about, you know, you understand more about the presenting complaint by asking OD-para questions or Socrates questions. Do you know the OD-para Socrates questions?
Yeah, Socrates is for chest pain, right? So like the time and everything. Yeah, site, onset. Yeah.
Absolutely. Yes. Exactly. So that way you get an idea of where the pain is originating, what is the pain due to. Okay, so this was also almost along the same lines, right? You need to understand why the presenting complaint is happening and what is it due to, right? So once you've understood the presenting complaint, you have to ask the PMAFTOSA questions. So do you know the PMAFTOSA questions? I can just explain them to you.
Would that be like past medical history and everything?
Absolutely.
I have no clue. I don't know. I feel
Okay.
like MA would be past medical. I don't know.
Right.
A would be what? Allergies, I suppose.
Exactly.
No way. No. F would be for food. No.
Family history. So in this,
Family history.
family history is very important because that's also adding on to the confidence that this is a, you know, febrile seizure, because febrile seizure actually runs in the family. So if anybody in your family has had any, you know, seizure related problems, epilepsy, so then you have more clue that, all right, if you get a positive family history for this would be more likely, you know, that, like in cases of, you know, breast lump. So especially family history is such a strong indicator there. So that's very important to us, family history. So in children, instead of PMAFTOSA entirely, because PMAFTOSA also consists of activity and
travel, occupation, and all this. But yeah.
so that's mostly for adults. But for children, it's actually P binds, which is past medical history. P is for
So
pregnancy.
PMAF, and then P binds. So that P
Okay.
is pregnancy, birth, immunization, nutrition, development, and social history.
Right. So you need to understand the level of activity. So even when you're talking about a child who is having fever, you need to understand, are there any red flags? Is he lethargic? You asked about the dry skin. It's a very good question because you're trying to rule out any, you know, red signs, red flags, right? So if he is dehydrated, if he's lethargic, if he's not responding, you know, if he's not keeping up to the milestones, you know, those are red flags. You need to pick up on them, because if there are cases of dehydration or sepsis, you need to treat them immediately and you have to treat them aggressively. Okay, so once you pick up the red flag, that means it's an admission case. You have to immediately admit the child. All right. So so you did ask about the pregnancy. Birthing would also be in. Was there any complication with the pregnancy or birthing? Jenny's pregnancy or birthing? They'll be like, mostly it's no. So that's great. And so in the UK, to understand the developmental history, they have something called, they record all the developmental history in something called the Red Book. So they are you satisfied with your Red Book? You know, that's one of the questions that they ask, you know, keeping to the milestones. So if they say yes, so that just means that, you know, they are in keeping with all their developmental milestones. So that's great, right? So that is one question that is specific to the UK, you know, the Red Book. And Right, vaccination history, are they up to date? Is there any infection that she was not vaccinated that could be causing the fever, right? That's what needs to be also on your mind. And yeah, and basically, since it's a child, you need to also understand, surrounding of the child, because you're not only treating the disease, you're treating the person. You're giving a holistic kind of a treatment for the patient. So you need to understand a little bit about their socioeconomic. I mean, socioeconomic when it's adult, but the social aspect to the child, like who takes care of the child, when you're not there, who's the primary caregiver, because the primary caregiver is the person who would be able to answer the maximum of your questions. So to understand who the primary caregiver is very important for you in this situation, right? And who takes care of the child if you're not around, right? So this again becomes a very important history when there are cases of non-accidental injuries, right? So sometimes the child might come with like a spiral fracture or might have multiple scenarios of admission. So you're trying to understand who takes care of the child, who is the child with, the maximum of their time, to deduce your diagnosis. So these are some of the questions for pediatrics, but I guess you covered most of them. But you need to be very specific on what you're asking. I'm actually saying that because once you get your diagnosis, you have to rule out the red flags and you have to rule out the critical conditions. Once you're done doing that, you need to understand the surrounding and then move on to management. Because this exam, the consultation is only 8 minutes. So
I feel like that's the problem. I feel like in real life, I take more than that time. So I was like, it's relatively easier to do it in real life. Like, not real life per se, but like non-exam conditions.
I totally agree with you. And that was some problem that we were also facing. So we created this consultation guide where we have, we have written down, what to do at every 30 seconds. So given the 8 minutes of the scenario, if you have to cover the scenario within 8 minutes, this is something that you can actually do. I mean, if you go through this, list as you go along. So this works with the timer.
Begin. Into the room.
I just switched off the speaker. So yeah, so it goes with the timer. So you see if it's highlighted, if you are at that section, if you actually cover all these points, that would be the major chunk of this case, right? So we highlight all the major points in our consultation guide. So even though you might get strayed into asking irrelevant questions, so you need to keep that in mind that, it should be only relevant in this case. Sometimes you might be running out of time. So move on, just go to management, because management consists of 4 marks, data gathering consists of 4 marks, and interpersonal skills consists of 4 marks. So if you're going to give 7 minutes to data gathering, you only have 1 minute to get all those 4 marks. And that's not fair. So you might just be getting 0.5 more or just 0.25 more by asking 1 extra question in data gathering. And you'll be losing like 2 marks in management. So, have that playing in the back of your mind, because they have a prompt that goes off at 6 minutes where the prompt goes saying 2 minutes remaining. So by that time, you should have already mentioned what the diagnosis is, and you should have already started with your management. So when you hear that prompt, you should think that you're not taking any more history because time for that is gone, right? Don't get worried. We're just giving you tips.
No, I completely understand. It's actually a very relevant tip. So I really thank you for that.
Absolutely.
It makes sense because, yeah.
So yeah. So coming back to the management now, let's start with the management. So management starts with actually telling the mother or telling the patient what the condition is, and you have to tell that in technical terms and explain it in layman terms. So because they are definitely going to want to know what they are suffering from. So if you say the patient is suffering from something called AML, right? Even though you want to say something as simple as, unfortunately, you have, bone cancer, blood cancer. I mean, you have to definitely tell them it's AML, because they would definitely want to know about it. They want to go and Google about it. So if they just Google blood cancer, there'll be like a huge list that will be coming out, right? Like which part of the blood is cancerous. So they wouldn't know until you tell them. So definitely tell them in technical terms. I mean, like the medical term, as well as explain it in layman terms, so that later on.
In fact, that's the only point where you can use medical jargon, which is basically the diagnosis. That's the only place where you can use the medical term, and then you explain it in layman terms after that.
Okay, that makes sense.
So do mention from, just summarize a little bit, saying that from what you have told me and from the examination that I've done, it looks like the fit that your child suffered from was due to a condition called febrile seizure, right? So once that, so then they'll give a minute for them for it to sink in. And then ask them, do you want me to explain that any further? Would you like to understand more about febrile seizure? Most of the times it will be yes. So then go ahead and mention what it is. This is usually because of high temperature, the body's internal mechanism. There is the child suffers from these fits, and we are suspecting that this fever is due to an infection that she is suffering from in her ear, right? So you're even telling why the fit happened, because of the fever, and why the fever was caused, right? So you're giving them an idea why this happened to her, because she has an infection, her fever was high, and her fever went so high that the body's internal mechanism couldn't regulate it, so it caused her to have a fit, right? So then there is like an idea in there, they understand what is happening, they'll be like, all right, okay, now I get it. So what do we do about it? Is this meningitis? It's like, it's not. Then you can actually explain them that the infection was in the ear. It's not something, meningitis is when the infection would be in the covering of the brain. So the infection fortunately is not there. Meningitis is a more dangerous condition, which is not happening in our case. Like, because always address the concern. Definitely address the concern, because whatever is the concern, you have to answer that. That is that's actually a part of your task, right? You are actually answering the questions that they are asking. What is their expectation? Their expectation is to know, this is not a critical condition. Put their mind at ease by saying that this is a fairly common condition in children from age 6 months to 6 years. Right, that's again going a little deeper. So if you go read every case, then you'll understand what are the nuances of these individual cases. But yeah, so febrile seizure usually happens in children of 6 months to 6 years, and it's fairly common. And one of the questions, and then keep encouraging them to ask questions, like, do you have any concerns, or do you have any doubts? So then one of our other concerns would be, will this happen again? So there are chances that this might happen again, but we will give you ways to lower the temperature. That way, it might not go, the fever might not go that high, so that it will cause a seizure, right? So you mentioned paracetamol. Also give other methods. If the paracetamol, so she did try paracetamol, it didn't work, right? So you can say that we can increase the dose and the frequency of the paracetamol, and along with that, you can give other additional methods like tepid sponging, have like humidifier in the room if it's a respiratory tract infection. So you have to always tell them that if there is an infection source, we have to treat it first. So primary treatment in this case would be to treat the otitis media, right? So that's what you need to say. So to reduce the temperature, we'll be giving paracetamol, and we also need to combat the source for which this infection is happening, which is causing the fever. So we will be giving antibiotics. So you found out that she is allergic to amoxicillin. Amoxicillin is usually what we give for otitis media, but unfortunately is allergic. So the BNF is British National Formulary. So it's like a dictionary for all the medications. It gives you information on what all medications is given for what all condition, if there is any interaction. So that's the British dictionary for the medication. So it's called the BNF. So mostly because there is an interaction, that's why the BNF is mentioned. So sometimes when there is an interaction, usually the doctor looks into the BNF to see what is the alternate medicine I can give in this case. So in this case, you give azithromycin or clarithromycin.
Yeah,
So
the macrolide.
the macrolides, right?
Yeah.
So that's so there will be a BNF in front of you. If you don't know the what to give if the child is allergic, you can always refer to that because it's already provided. Or else another way and a more time-saving way is to tell them that I will so since she is allergic to amoxicillin, unfortunately we won't be able to give it to her. I can speak to my senior and can come up with a plan for an alternative antibiotic that we can give her, right? That will save you a lot.
Yeah, true. It's so time, it would be like, I would be flipping the pages and I'd be like, oh, which medication to give? Yeah, so it's much better to always refer.
Yeah, or else another thing that you can say is I can refer to my book and I'll be referring to my book and be giving you a medication that can be given to treat this infection. That's another way of doing it, right?
Yeah, that way it's basically showing the examiner that you know what to do. That's enough.
So it's just knowing what to do. Got it.
Exactly.
Yes.
Because you don't have more than 8 minutes. You just have to show them that after this, this I would do this step if this is the case, right? So in this amoxicillin allergy is the case, so what would you do next? You would either talk to your senior, or else you'll be referring to the BNF to actually see, or else you'll actually be doing that. So doing that is the worst option in this case because that'll be the most time consuming. So you don't want to, right? So it's easier to actually say what you would be doing. So that's why they actually do give you a BNF just in case, if you want to go ahead and look.
Yeah.
So, right. So explanation of another thing. So for the management, so you have treated the fever, you have treated the infection. Now you have to give them steps of if it happens again, what to do.
Oh yeah, rush to the ED. Yeah.
So during the fit, what to do. Right. So if it's a febrile seizure, you might not have to rush to the ED if it's not more than 5 minutes. So during the seizure, to keep the child safe. So make sure that there are no, sharp objects around. Put the child in recovery position. Do not put anything in the mouth. Right. So if it lasts for more than 5 minutes, call the ambulance. Right, take them to the hospital if the temperature still remains high after trying different methods to reduce it. Right, so those are the important facts that you have to keep in mind, that this child has come with seizure. If this happens again, because in a situation like this, it can happen again. So what is an important information to give the mother is what to do when this happens again.
Yeah, so you might not have the time to explain it. So what you have to do is you have to tell them that I will tell you what to do if it happens again. That's enough. That way
Okay.
you don't actually say it, but you say that I will tell you. That way, even if your time runs out, the examiner knows, okay, she knows that this is important.
Okay.
So they are trying to assess if you're a safe doctor. So always have that running at the back of your mind. If I leave this child, if I send this child back home, what are the things that can be, dangerous for him, right? 3 things that we always tell every student, every candidate, every scenario where this can be applicable in some form or the other is try to include this in your management is safety netting, follow up, leaflets and pamphlets, because an educated patient is the best patient you can have. So follow up, usually because this is a pediatric unit, you can always follow up with the GP. This is the general practice. So every patient first goes to the GP, which is their first point of contact, and the GP refers them to other specialities if needed. Otherwise, most of the management in the community is actually taken care by a GP. So,
yeah, and even the GP, they won't be able to get to the GP in the first place. It's very difficult to actually get an appointment in the first place. So you always set up a follow-up appointment. That way, they are not just asked to follow up. Like they have there's a way to see what is happening to them in a few weeks. All right. Otherwise, it's going to take them months to get another appointment to go and see the doctor again.
So definitely once you do set a management plan, you always have to follow up with the patient to see how that management plan is working out for them. So always set a follow-up, give safety netting. If you haven't, if you manage to get to the diagnosis really fast and you didn't ask any of the questions for the critical cases, give it to them, saying that if you see that she has any shyness to light, if she has any neck stiffness, if she starts having rash or the fever is very high, and if she has fits more than 5 minutes, please come to the hospital immediately.
Yeah, that way, even if you had missed the red flags in the data gathering, you're still covering them here. Because that way you're showing the examiner again that, okay, I know the red flags that I need to ask for.
Yeah, anything like lethargy, dryness of skin, if she's not active, please come to the hospital immediately, right? And the last one, leaflets and pamphlets. So NHS has made leaflets and pamphlets for every case, every scenario. So this is something that you can, openly saying that, I would like to give you some reading material. I'll give you some pamphlets so that you would be better aware of this condition and what to do in this kind of scenario, right? So always try to somehow fit that in, because always mention leaflets and pamphlets. So one other thing about epilepsy in the UK is that everybody who has had a fit, they go to the first fit clinic, right?
Okay.
So anybody who has had a fit, no matter what the fit is, even if it's a febrile seizure or you wouldn't know that it's idiopathic, you would always refer them to a first fit clinic. So remember that fit cases, cases with seizure. So first presentation of seizure, if it is a first presentation, if it's a known case, then you don't need to do that. But if it's a first presentation, always refer them to the first fit clinic. So that's an important point. So some cases have certain nuances like this, but you'll find out, you get to know. But yeah, this is your checklist. So for data gathering, I think you managed to ask most of the questions, just that you didn't get to the point of, the infection, the source of the fever.
Yeah.
Understand family history would have also been a good question to ask. Management was, I guess you ran out of time. That was one thing.
Yeah. But I did do I feel like I did say that come to the ED if you feel that you have any other symptoms out of the ordinary, like if you have fever that is very high and you have a fit again. So I said to the ED. I think it's in the safety netting, right? I think it would be in the safety netting.
That's covered, right? As far as you some important.
Yeah.
So I think I should have given you a mark over here, but definitely. So otherwise, I guess we covered most of the points. Right. But management is something that, you have to get.
Oh, there's one session. I feel a bit happy about it, not gonna lie.
Yeah, we feel that you've done great, especially for, a first mock. This was a very good performance.
Yeah, really? I feel like crying right now because I feel like I did so bad because I missed so much and I feel like I should have done better.
Not a problem at all, because one thing is that you have a natural, tendency of actually talking empathetically and calmly. That's very good. Keep that up, because that's going to help you a lot. You'll easily get 4 out of 4.
I had no way to, not give you marks for in-person. You got completely 4 out of 4 there.
Yeah, so that way your data gathering and the personal skills, if you manage to get 4 out of 4, even if your management you don't have enough time, you'll still be able to pass the station somehow.
Okay. So did I fail today? I think I did. What is fail though? I don't understand.
Okay, so that's so now depending upon how the station went for everybody on that day, an average score for every station would be calculated. And if you're more than the average, then you pass. And if you're less than the average, then you fail.
Yeah,
so it depends upon who else is with you in the room.
So it keeps changing. On average, it's like between 6 to 10. So it's very varied. Like sometimes if you get 6 marks out of 12, also you'll pass. Sometimes even if you get 8 out of 12, you'll fail. So it's very difficult.
Okay,
So,
okay.
yeah, so just keep try to keep these main things. That is, in data gathering, always think about the red flags. In management, always think about safety netting, leaflets, and follow-up. And in interpersonal skills, always empathize, always signpost. You know what signposting is, right?
No, I don't. Is it, what is that?
So whenever you're so signposting is basically when you're moving from one section to another section in your questioning. So you have to tell them that there is something else happening. So for example, you're going to ask them something uncomfortable. It's mostly for that, but it's you can so it's mainly when you're asking uncomfortable questions. For example, you're asking about smoking or alcohol history, or if you're asking about previous abortions, or if you're asking about sexual history, menstrual history, you always
Uh,
have to give them a warning saying that I'm going to ask you a little bit of uncomfortable questions. You don't have to say
oh,
uncomfortable.
Means it personal
Yeah.
questions.
no, I
Okay.
understand. I feel like that comes very, I don't know, I would say like that would be unkind of me to ask them straight away if I'm asking something which is personal, and that would be like coming abruptly to the patient. So I always tend to ask them if it's okay if I ask some personal questions before actually going in and asking them.
Exactly.
That's
Yeah.
called what again?
Yeah, you
Sign.
managed to separate
It's
without
called
knowing what it is. Yeah.
it's called signposting. So you actually tell them something, uncomfortable is coming up. So
Oh, okay, I did not know that, but that's a nice word for it, signposting. Okay, thank you.
so
Okay.
Yeah.
sometimes you might not actually think it would be that uncomfortable. There would be a lung cancer case, and you need to ask about the smoking history, and you already know he's a smoker. So you might actually just jump right into it. A lot of people do that. So always keep that in mind, even though you do know that if this patient is a smoker and you have to, the case is about, so there is one scenario of counseling where the patient is having lung cancer and he still continues to smoke. So your task is to advise him for smoking cessation. So before
Mhm.
that, you have to ask a little bit of history about the smoking, like his smoking habits. So even though he is smoking, he knows he's smoking, everybody in the clinic knows he's smoking, you still have to signpost, right? Even though that is your task, even when you getting right into that conversation, like, I'd like to talk a little bit about your lifestyle, if
Okay.
that's all right. So and then go into asking, do you smoke and how much and all that.
Yeah.
Okay, that makes sense. That makes sense. Thank you. Yeah,
It also
appreciate it.
applies for any questions that you don't even, all you have to say is that this is something that we ask everyone, and then you go on. So that's
Okay.
signposting. Like, so that way you don't have to say what you're going to ask them also. So it
Uh,
especially applies to things like, suicidal tendencies and in depression, especially. So that's there you don't really have any other way to signpost instead of without actually mentioning that, yeah, this is something that we ask everyone. Have you ever had any feelings of, self-harm? Naveen?
yeah, I understood. Thank you. Yeah, thank you.
Yeah.
Mhm.
But yeah, other than this, I think you're actually you are ready to, book your exam date.
No way, really?
But
Yeah.
try to actually book it in such a way that you would have a chance to actually understand what is the scope of the exam, what all are the different scenarios.
Mm.
Yeah,
So,
I feel like I have to read a bit more on that. Yes, you're right.
but that's all right. So we actually have, so all the scenarios that are there, so we've collected around 480 cases. That is only the talking stations. This is barring from the examination procedure and mannequin. So
Mhm.
cases we have actually cataloged in such a way that we put it into topics, and within topics we have categories, and within categories there are maybe some subcategories, or there are cases, so you can understand the
Mhm.
variety of cases. So even if you go through our brain bank and see what all are the different kinds of cases that can come, and try to do one case from every different subcategory, I think that would go a long way, because that way you'll actually understand vaccination, what are the important things to ask, milestone, what are the important things to ask, right?
Mhm. Mhm. That makes sense. Yes.
So
Okay.
if you make an account, you'll be able to access the page, which is the dashboard. So there's a case. We'll be able to see all the types of cases that are there. So let us have an idea of what all can come.
Okay, that makes sense. Yes, thank you.
And
Yeah.
I will send you a link to our YouTube channel, so that gives you an idea about, you know, in a day what all are the cases that comes for sure. Like in one exam, definitely you will have a mannequin, you will have an examination, you will have a breaking bad news, you will have an angry patient. So having done these sections first, you know, getting them out of the way, that way you would actually know how many stations you would definitely have a prescription. So, you know, that'll give you a better idea of, you know, how this exam is conducted. So anyway, we'll send you the, you know, link. You can check out some of the videos there. We'll try to talk about it as much as possible.
Okay, thank you. I appreciate that. Thank you.
All right. Thank you, Annabeth. This was really fun.
Thank you. Thank you for this. Can you send me the link and everything? And that was really lovely. I actually think I understood where I'm lacking. I feel like I really need to read a lot first. I think from the books and everything, because I'm not sure how this is supposed to go, because I usually went the way that I would in my clinic. However, I should have a different way as well of going things. I feel like it's more exam based. I need to know what they should be asking. It's not how you would do it in real life. It's about what they want you to know, I suppose. So I feel like I need to. Sorry, you were saying?
I think there are some things that you ought to, you know, what you had done for this consultation. I think it was pretty good. I mean, you had a very natural way of going about from one section to another. You had a data gathering structure, and then you went on to management, which was actually pretty good. But in like coming to the source of the diagnosis and you know, why it's happening. So yeah, I guess in some cases, I guess you'll have to look into that. But I guess you're in a very good position, I would say.
Yeah, and don't just try not to just spend too much time just reading. Whatever you read, always try to practice it. If you have a practice partner, just find anyone who can speak English. Just ask them to be patient. Just practice with them.
Or else we have you know, patient avatar that you can actually practice with. Because one thing you can do is you can read the case on the workbench. You can understand how to go about the case, like in the case over, and you can practice with the partner. So I mean, we have the app.
Okay.
Try to keep it as similar to how you would see it with the voice prompts and the candidate info. And then you just click the button and you start talking to it. And if you send, it'll get registered and they'll give a reply.
Ah, okay. That's actually pretty cool. Okay. That makes sense.
So if you're actually finding something relevant, like I'll just ask, hi, my name is Dr. Anne. Can you please confirm your name and age for me? Thank you, Adrian. Can you tell me what brings you here today, Adrian?
So I think you can't hear the.
No, I can't, but I did understand the whole gist of it.
Well,
Yeah.
speak back to you. Yeah.
Yeah, it has a very good capability of catching your talking. I feel like not a lot of computers can, and I feel like you did a great job at making this application. I feel very angry at the software developers of certain, I don't know, companies, and they just don't know what they're doing. I feel like you guys have a future in software development as well, like doctors and that as well. That's amazing, honestly. I have to give you credit for this. It's so beautiful and so pretty, like aesthetically pleasing website. You know, like Minecraft and stuff. It's so pretty.
Thank you so much. This is all Rohit's brainchild. So
wow, amazing, good job, sir. It's really good.
Thank you so much. But so we do have a 1 week free trial. Please try it out. So yeah, just try to practice as much as you can. So that's the only way to pass this exam.
And
Yeah,
if you
I
have
think
any questions, please feel free to reach out to us. You can reach out to us personally, or else you can talk to us on the group. We'd be happy to answer you in any way.
thank you. I appreciate that a lot. Thank you so much.
All right.
Thank you so much for today. I feel like I've taken so much of your time with my
Oh.
questions and everything, but it has been very fulfilling. I feel like I've understood a lot about this exam. So thank you for that. Thank you. I hope you guys have a nice evening, I suppose, or a nice night, or a nice good morning. I don't know what's the time there.
Night over here. But
Oh my God. Hope you guys have a good night. I hope
You-
it's not too late for you guys.
no, it's all right. We actually enjoyed
Okay.
this so much.
Yeah.
Ah, okay. Okay, that's nice then. Oh, I just saw the time. I can see the time in the little computer thing. I think it's like, it's, oh my gosh, guys, you guys need to go to sleep. Oh, I'm so sorry.
All right. Take care.
Thank you so much.
Bye.
You
All
too.
right.
Goodbye.
Please like and subscribe to Turing Med School. Good luck with your preparation.